everybody. So today is part one of my video on ALS awareness. Um, let's start off with it. So what is ALS really? Well, ALS, better known as Lou Gehrig's disease, it's also called amyotrophic lateral sclerosis. It's a disease of the nerve cells in the brain and spinal cord that control voluntary muscle movement. Every 90 minutes, someone is diagnosed with ALS. It's a progressive neurodegenerative disease that causes muscle weakness, paralysis, and ultimately respiratory failure. It's also known as Charcot's disease, motor neuron disease. It attacks certain cells in the brain and spinal cord needed to keep our muscles moving. Early signs and symptoms of what you could expect from ALS, they'll include things like muscle cramps, muscle twitching, weakness in the hands, legs, feet, or ankles, difficulty speaking, even swallowing. The senses, though, with the hearing, sight, smell, taste, touch, they're not affected by ALS. That's one thing that's not affected by it. Well, multiple things, I should say. There's no single diagnostic test for ALS, however, and that's unfortunate. But experts in the disease, usually neurologists, that specialize in neuromuscular diseases, they're very capable of diagnosing ALS. Or so what it's stated. In some cases, though, they might order additional tests if the diagnosis isn't really clear, so to speak. So what else about ALS? Well, most people that have it, they usually live with the diagnosis, usually live between 2 to 5 years after the first signs of the disease. About 10% of the people, it says, with ALS, they can survive at least 10 years. So there's still a good lifespan even after you're diagnosed with ALS. You still have time. It's not the end of the world, people. But this variable rate progression, it does make the prognosis difficult. It makes it difficult to predict, and therapies, they're really hard to develop different types of therapies for this. Currently, there's only one single medicine for specifically treating ALS. That's Riluzole. It's a drug marketed by Sanofi and Ventus, and it's under the name Rilotech. It extends survival maybe 2 to 3 months. So it still gives you some sort of sense of hope. This unmet care, though, there's still need for more effective treatments. Definitely more need for it. It's a devastating and fatal disease, people. It's the basis for research and drug development effort. But it's at the nonprofit biotech organization. You can go and check it out. It's ALS Therapy Development Institute. You can look them up, learn a little bit more about ALS and things of that nature. What you can do to help spot early signs, whatever you need. Let's talk a little bit about the disease, though. In people with ALS, the motor neurons, they deteriorate, leading to muscle weakness and paralysis, that we talked about before. But why these cells are particularly vulnerable remains an open question. The scientists and things of that nature, they're beginning to unravel how those cells are destroyed and how it's leading to new ways to attack the disease. So they're trying. They understand that this neurodegeneration is extremely complicated and it occurs through several mechanisms. All right. Yes, I'm reading off the paper because, let's be honest, nobody's going to remember all this stuff unless you are very well knowledgeable on this thing, and I'm unfortunately not. This is why I'm bringing more alertness to people, to get them to understand about this. Misfolded proteins, they can accumulate. Sodium channels act up. Epigenetic and genetic switches are thrown. Energy producing mitochondria, they malfunction, leading to a power drop. It frees radical buildup, increasing oxidative stress, and toxic substances can accumulate. All these mechanisms appear to contribute to motor neuron destruction in ALS. Many more are suspected to play a key role in the onset and progression of this disease. So let's talk a little bit about, what they've done since the 80s, okay? Since the 80s, scientists have recognized that ALS is much more than a motor neuron disease. Excuse me. Astrocytes and microglia, I think that's how you spell it, or how you say it, I should say. They're entrusted to keep motor neurons healthy and free from infection. Free from infection, turn traitor. Let's see what else. Producing toxic substances that damage them fuel the progression of ALS. Macrophages and certain T cells infiltrate the nervous system, potentially unleashing a storm of cytokines of their own that further contribute to the disease. There's a big word here I can't remember how to say. I don't know how to say it. Oligodendrocytes. I don't know, people. But they appear to lose their ability to power motor neurons up in people with ALS, contributing to the energy drain and their destruction. Well, I do apologize that I don't have much more on that within my first video, but I'm trying to keep them as short as possible, and everything that I've been researching is off of the web, so I know just as much as everyone out there knows that isn't a professional in this area of expertise. So look, people, everything that I've been talking about, it's a real dangerous disease. It really is. But like I said, it doesn't mean the end of the world necessarily for the people that have it. You still have a relatively decent lifespan, and even though only 10% of the people who live longer or up to 10 years with the disease, it doesn't mean that 10% is a solid statistic that is only going to stay that way forever. This is just one disease out there that is very underfunded and very under-researched. Research can only be done with the amount of funding that needs to be done for this type of disease. Without the funding, how can you expect people to research this? Cancer patients have a better chance nowadays of surviving than those with ALS, because cancer is extremely dangerous. I get it. But there's really more treatment options out there for people with cancer. Most people with cancer are determined to be terminal. However, with the right amount of chemotherapy and things of that nature, and catching it early enough, a lot of people have come out cancer free. And that's great. But what does that mean for those with ALS and all those other under-funded and other under-researched diseases? 2 to 5 year lifespan? I mean, it sucks to tell a family member that you have anywhere between 2 to 5 years left with them, and 10 years possibly if you fall within that 10%, but it's no way of telling. How do you tell someone that? How do you tell someone that there's not much treatment options out there available for them? How do you tell someone that when cancer patients are getting so much more research and so much more things done and are living longer lives? How do you do that?